All right, well, I'll go ahead and get started. First, I wanted to introduce myself. For those of you we haven't had a chance to meet either through this virtual town hall format or in person, I'm Stephanie Harris, Chief Executive Officer for Arrow Senior Living. I'm glad that we are through several of all the individual town halls that we had per community. I think some of them are going to be scheduling multiple or another round of those conversations. But I think that this will be another format for us to discuss broader company initiatives as we begin to reintegrate back to a more normal course of business. And I have to point out, it was interesting as we were working on the phased reintegration that I'll spend a little bit more time talking about phase one, since we're in the middle of turning everything back on right now for phase one, but also give you a sense of what we're thinking with the future phases. Again, a lot of that is going to be subject to if for some reason the CDC tells us to slow something down or says we can speed something up. Something might jump from one phase to another phase. Sorry, my dog's going to join us here. We may see some movement from, we might be in the middle of phase two, and all of a sudden the things that were in phase three might be able to be included in phase two. At the same time, if there were suddenly an increase in cases, we might have to revert back to another precaution or another process. And the goal will be that where things happen across the company, that we'll try to use this format as much as we can to explain what's going on and why we're looking to do that. And lean on, I see Cindy here, our executive director from Boulevard Wentzville, but we'll be leaning on the executive directors to speak about specific building actions or responses and timelines, because the timeline for the entire company, because we're in different cities, different counties, different states, can be different than what the timeline might be for another community or for the company in general. So we're going to lean on some building specific information still being exchanged through town halls that are happening in this format for your community. I know Cindy goes from zone to zone to do town halls, and other executive directors have done that over the course of the last so many weeks. So they'll be still the primary source of information when it pertains to your specific community. When we last stopped doing these calls, we didn't have as much participation as we do today. And I'm looking over at the participant list. We have a lot of our tablets being used for this call. So it's really exciting that this has been introduced so more people can participate in our virtual events. So I think it's just exciting to see how in the middle of some not so fun times, we've had a lot of people learn some new technology and embrace a new technology. So I'm impressed. I gotta tell you, I'm extremely impressed. The fact that I hear at various events, the residents are feeling active about using the chat to using the applause section or raising their hand. And that is so cool because I can tell you there are a lot of people who have used, who think they're great at technology that still haven't mastered Zoom. So more power to you, and you deserve an award, because a lot of people that think they know something about technology still don't understand this program. So very exciting. Well, I wanted to first cover, I imagine you come to this conversation feeling a couple different ways. You either are feeling very locked down and it's just, this has been tough for weeks and weeks and weeks of having this disruptive lifestyle. And you might also be coming into this call feeling a little nervous or scared about taking that step out to start participating in resident events and the dining in the hallway and some of the things that are happening in our zones. Or you might feel a combination of the two. You want to get out, but you're just not so confident with, I have been just absolutely amazed how compliant, but for a few, exceptions here or there, you guys have been terrific in understanding this unusual time and unbelievably unusual precautions that have had to be taken. We weren't talking the word social distancing 6 months ago, and it's probably the most hated word now in the in our vocabulary. But it has done wonders in keeping our residents safe and at helping our country flatten the curve. So there's still some really great benefits from that now new dirty word that I think you're going to be hearing as a part of like our day-to-day life for many weeks, months, and possibly years ahead. As we understand more and more about these viral infections and as they understand more about this particular COVID-19 coronavirus. So I want to be really clear that we believe confidently that if you are using your mask when you're around others, when you're coming out to participate in the zone, so say you're sitting at your apartment door, it is completely safe for you to be able to participate in an event with that mask. Now, what's important though, you probably noticed the Surgeon General, I think it was on Friday or Saturday, the days they all run together in my mind. So I could be quoting the wrong day here. The Surgeon General said, for the normal individual, mask use is probably not recommended because it actually creates more tendency to touch your face and sort of bad hygiene. But then they say that even seniors, that they're vulnerable, it's an extra protection. So what that says to me is we have to incorporate the mask use, but we have to make sure it's safe mask use. And so we're going to be talking a lot more about how to safely use the mask. So it's not a beard guard. So putting it below your chin where your nose is exposed and maybe your mouth is covered or your chin is covered is not safe use of a mask. And touching it, they say you're 23 more times likely to touch your face with a mask. Where if you remember when we shared a physician video with you about probably over a month ago now, he said, use a mask to train yourself to not touch your face. Well, we're becoming a society where mask use is now being required if you go to Costco. And I think Walmart now is requiring mask use. I haven't been out of my house except to go to work. So I can't speak to what is being required at all of the retail, but it's becoming more common practice. But if it's not done correctly, it can be just as dangerous. But even when the Surgeon General is saying not that, but somebody under normal health circumstances, it may not be as important. They are advising that if you have any illness yourself, or if you are in a vulnerable population, which, anyone that's, over 60 is more at risk, and anyone who's over 80 is even more at risk, it is still one of the best tools to use to protect you and to protect others in case you have something you don't know about. There's a lot of asymptomatic carriers. When we did mass testing, it was amazing how much, it revealed a couple people who didn't even know they had COVID-19. So there's just so much we don't know. But what they are advising is that you continue to use the mask. And we are asking, in order to participate in around others and to be safe, that the mask be used when you're around each other. It's for your protection as well as a protection for others. Now, at the same time, we got to make sure we're not touching our face. And the other advice that's being given, so is if you leave your apartment to go at your doorstep to maybe have your meal or to participate in an event in the hallway, we are asking that you wash your hands before you leave the apartment to protect yourself, and to wash your hands when you return. Even if you just went to your doorstep, it is the best way to make sure that you are protecting yourself from what your hands could have picked up. It's amazing how tactile, how we, as a human being, we crave touch. We touch things, we grab things. You just don't know. And I bet you, if you watch yourself over the next even 10, 15 minutes, count how many times you may touch your face and you didn't even think about it, or unknowingly touched your face. So it's being recommended that you increase the volume of times, the amount that you are, or how the frequency of washing your hands, as well as the length of time that you are washing your hands. And a 20-second cleaning, singing happy birthday, or humming it in your mind 2 times over is a good rule of thumb. That taking these basic precautions makes it completely safe for you to participate and begin to re-engage, reconnect. The unfortunate thing with this disease is that, and this has continued throughout. While the top cause of death is not COVID in the United States, it's still heart disease. It's definitely had COVID has increased. But as we're going to find over the course of the year, as things normalize, normal aging can have a greater impact on us. But I can tell you this, that when COVID hits, there's no mercy. And that's what we're defending against, is making sure that you are, COVID-free, safe from that. And these basic precautions will allow you an expanded sense of normal by being around others. And that with these precautions, this will allow you to be, to feel confident that you can safely enjoy interaction with others. I'm very much about shaking people's hand. I love being able to do that. And I met somebody earlier today, and it's I had to tell myself, do not shake their hands, until we get this settled out and what we understand. Taking these basic precautions, we all just need to commit to doing it for the safety of ourselves and our neighbors. I was reading in the Wall Street Journal on, I believe it was Thursday of last week, again, days running all together, that there has been some work. So now that the state of New York has begun to have the decline in cases, they've met their peak hospitalization. The state is starting to do a lot of review of the individuals who developed COVID-19. And what they're finding is that it's more shocking as to who it impacted versus who it didn't. They suspected, because you've seen on the news, they suspected it would be predominantly in nursing homes and senior living communities. And what they found, it was actually quite the opposite. It did largely impact retired individuals, but if you were unemployed and retired, you were more likely to have developed it in the state of New York. And I think it's going to be interesting, because they were thinking it was going to be nursing homes and other communities like our communities that would have the most amount of cases, because you're hearing it all over the news. Well, we have reporting requirements, and we have to tell you if there's a case, or we've committed to doing that. And what happens is the press is reporting these cases, because it's easier to say that a community has had a case than to say somebody's individual address. It's just not a newsworthy event for somebody to report them at a single location. And so I think we've become victim of a lot of press. But I was really interested in reading that folks were actually far safer in those environments than they were if they had fallen into some of these other categories of, post-work life and retirement or unemployed. And I thought that was really, really interesting. And many of our states are still rounding the top of the peak of the hospitalization, and we're a week or two from it. So we don't know a lot yet. But I'm curious to see in the months to come what the Department of Health in our counties and our states have learned from the cases that have popped up in our states. And certainly will be a lot of great information for us as we develop, our practices and policies and understand what we can do to tackle this disease as aggressively, or this virus as aggressively as we can, to defend our residents and our employees from this. We're also looking at a lot of technology options. I'm really excited about We've got a camera system that we already use in our communities. It is our closed caption TV, closed circuit TV. Sorry, I said that the wrong way. That has thermal readers and facial recognition add-ons that we can do. We're going to be looking at that as an option to eliminate all of these manual temperature tests that we have to do. It actually can be done electronically. So our chief wellness officer right now is going through demos and trying to understand more about how we can incorporate that, where we can, just as you pass through a door, it could grant access because it recognizes your face and knows your temperature is just fine. Or could prevent a visitor who had a temperature from entering the community. We've got to look at some of these ways to understand how to be practical in how we battle our ongoing screening practices. So we'll be sharing more with you as we feel more confident about implementing that. Until then, we're going to continue the manual screening processes. And I wanted to just pivot for a minute and talk about the phased reintegration. So we're in the process of getting letters out to each of the residents. So you probably have already received it, and out to the families. We're going to be posting it on the website because it's possible that who we are in communication contact with online or by text or email or mail may not be an entire family who wants to see any of the letters or the information we're posting. So it's going to be added to the property website as well as on Arrow Senior Living's website under our COVID link. And you would have gotten a colorful document called Phased Reintegration. And we are nearly in phase 1 for all communities, but most communities are in phase 1, which the trigger for phase 1 was the state or local guidance of reopening. And what we're finding is, for example, some states may open, today, but may delay certain parts that we have listed in phase 1 until later in the month or into June. For example, salons, they're not open everywhere, but they can be open in many of our areas. So we're excited about, during phase 1, getting all of our salons reopened, and we're working with the salon operators to see if they will commit that who they have coming in is not still seeing the general public, that they're being more selective and focused on working in our community or only in our communities if they work at a couple different of our communities, because we understand the practices that we're taking in our communities, but we want to make sure that they're not being adversely affected or exposed to a broad audience that could be more that could present an unknown risk to us. So you'll see a lot of information being disseminated. So I don't know if I'm just going to look here. I see Rachel from Boulevard St. Charles. Is Peggy up and running with you guys, or coming soon? Not yet. How many weeks? A week or two? Okay. We're working with, what we're finding is some of the infection control practices under the license for salons are not as robust. And a lot of our operators just don't have maybe either access to PPE, or they don't have access to some of the steps we want to take, or they have to coordinate staff. So while the goal is during phase 1 to open those salons, it might take till the end of phase 1 to get them functioning or up and running at your community. So I have to carve that one out because it is so unique that it is on kind of a different time frame than some of the other activities. So one of the gentlemen was asking about the healthcare professionals' visits will resume as needed, and scheduled essential healthcare transportation resumes. We noted that on here because a lot of medical procedures were shut down. So even though we would deem them as essential, we were finding that healthcare practices were stopping screenings and certain patient procedures to clinic visits. And that was more the limiting factor. And now that we're seeing those reopen, we're seeing them resume. We also found that if you weren't working with a preferred home health provider and they were going to multiple communities, they weren't coming into our community. So now we're seeing more of them coming in. They'll be screened and we'll be following those processes, but they may be more willing to come back to the community. Like podiatrists, for example, they stopped coming to our community, but they're now starting to come back, or they're starting to get on the schedule again. So you're going to see a normalized healthcare visit schedule resume, even though you may have continued to have some visits. Not every practitioner that we would deem as essential has continued their services, and some of them will begin those again now that we're in phase one. Same thing with healthcare trips. So if we needed to drive you to, let's say, for example, a female was having a mammogram and that was scheduled, we could drive to the clinic and have that, we could schedule that and have that trip coordinated. But if you were going out, we've even had certain blood work that was a part of monitoring medications reduced in screening during this time. You're going to see physicians beginning to put certain healthcare practices back into a more normal routine. I know somebody who is a cancer survivor who still has their port, and their port should have been taken out a couple months ago, that they've extended where it needs to be flushed out or potentially removed, that they've just delayed it during this time. Those things will go back to normal now that across, other than in Illinois, we're seeing pretty much all medical visits or clinics begin to reopen. The other points is that we are allowing new residents to move in. We've got a lot of people waiting to move into the community. We are still going to take the precaution that they spend, 14 days participating in their events and their dining from their zone, kind of in a self-quarantine, but it's still a part of shelter in place, and they still would be able to sit safely in the hallway at their doorstop and 8 feet away or 6 feet, whatever the distance of the hallway is from another neighbor, socially distanced. But we're putting more screening practices in place before they move in than what you went through when you moved into our community. So there's a few more recommendations for us to do. We've not had a lot of move-ins, but we expect over the next month that each community has got 2 or 3 people waiting to move in. So we do expect some movement. And we've noticed that the phone calls from families who've been trying to care for their loved ones at home or have watched them struggle living alone, we're getting more calls to say, tell me a little bit more about your senior living. So we do expect over the next month some move-ins, and over the next 2 to 3 months, a lot more people moving in. There was a period of time for about a week or two while we were waiting as a country, kind of the majority of our properties hit the peak hospitalization date at the same time, that we got a lot more aggressive in our precautions during that time period. And we feel that now that we're past that peak, that we can begin to start this reintegration from phase one. Visitation to communities face-to-face is still not recommended. And actually in one state, it's actually not allowable, where the other states, it's the guideline that you have to restrict visitation. And we believe that from the moment your state reopened, so a lot of communities, that was April 30th, May 1, that it'll probably be just under 2 months before we start to see some visitation back to face-to-face. And we may do it outdoors a little sooner, but coming into the apartment, coming into the community could be up to another 60 days. So we're encouraging as many folks to take advantage of window visits and virtual visits. Like, we've got to feel normal, and we got to feel connected to individuals the way that we can. And those are 2 by far the safest recommendations. And this past weekend with Mother's Day, I noticed we had a lot of drive-by tours and a lot of, I guess you call it parades and window visits. And I really enjoyed watching the social media that promoted the different the different celebrations. And boy, we have some loved mothers in our communities, that's for sure. I mean, it literally made me choke up, because I know how hard it is for I think there's a couple family members on this call to know that they can't, hug their mom right now, and they can't, be in the same room. But I know that your love for her safety and well-being is, trumps in that you understand, because families have been so supportive and so understanding in what has absolutely impacted the center of their family, their mother. I mean, what an important person. They've not been able to have that direct contact, and it got choked up because we have found other ways to celebrate our connections with each other and the family relationships, and our communities showed up in the most incredible way with some of the footage and the videos just the snippets I got to see. I can't imagine what that was like to be there in person. So thank you for those who made Mother's Day special for our residents, despite these unusual circumstances. So that's the basic. We're going to try to get more outdoor events going now that the weather's cooperating a little more. I know in Ohio, you're going to have the coolest May on record. So go figure. And even Missouri, I know we've had quite a few cold days, and we've got rain and things that we're continuing with. So weather permitting, we're going to be working as much as we can begin to get the zones out the door and getting fresh air and taking advantage of special events we can do outside. We are going to create separation by zone. So if we do something, let me give you an example. So if we had a barbecue event on Monday, it might only be for zone 1. And then Tuesday's barbecue might be zone 2. So we'll figure out how to create the same events, but separate the time so we can have good infection control and safer separation of practices to begin to get some of these normal things and taking advantage of this major spring coming into summer activities that we would normally have on our calendar, and figured out how to modify to keep those celebrations in place. So then the next thing we're moving into will be phase 2. And we've actually, this week is the start of phase 2 planning. So we are going to be working with each individual community, just as we did with phase 1. Each community presented their plan, and then we have our compliance officer and our chief wellness officer reviewing the plans with each individual community and making sure we've considered this or that, or sharing best practices. We're starting to, now that we only have just a few communities that are finalizing their phase 1 preparation, the majority have completed that. And you probably are already experiencing some of those, some of that reintegration from phase 1. We're now shifting to phase 2 because we are within the timeline of up to the next month or less, possibly some communities a little bit more like 2 weeks from now, that we're going to start seeing some of the benefits of phase 2 beginning. And there was a model of data that we were tracking that would give us the best indication of safety and feeling confident that we could start to have our common areas used again, and some of the things that we just took for granted 6 months ago. Part of the data we were modeling toward was based on new COVID cases falling below 1 per 1 million. And interestingly, even though phase 1 is not totally turned on yet for the state of Missouri, because I know Jackson County in particular is still delaying in Missouri, and then Ohio's also got some other phasing that they're doing as a part of reopening their area. Interestingly, both Missouri and Ohio are trending in a positive direction, that it is possible, for example, in Ohio, by the end of May, we may start introducing some phase 2 because the cases will have fallen below 1 per 1 million new cases a day. That means, so in Ohio, that means we would be having, just a few cases a day because the population is just a few million. It would be less than a dozen cases a day would give us indication that we're under a much safer time period, and the spread has really tamed. And interestingly, I think what we're finding right now, the growth of new cases across this country is largely happening in rural areas or secondary areas. The major service areas of the large cities have already had kind of the peaking of their hospitalization and their new cases, that we're starting to see it in smaller areas in a state than some of the larger, more populated areas. So Ohio is looking at the end of May, and Missouri is also looking at, right now it looks like more toward the first part of June, because we keep seeing cases drop and then they pick back up. So we will continue to report this information to you. We had to rebuild our own model because the site we were using stopped tracking this key metric. So we now are tracking it at the county level and the state level. So we'll make sure that Cindy, for example, can be targeting to the folks who live at the Boulevard Wentzville. She can be speaking, this is the date right now the model shows to open phase 2. Our job is to begin thinking about how we begin to start that process. And here's what it looks like. You'll be socializing in your zone and dining in your zone, but instead of having everything in the hallways, we'll be designating days to where maybe zone 1 is using the dining room or using the common areas or the fitness center or the swimming pool. And then maybe zone 2 is on Tuesday. Or we'll have days of the week or times of day. Morning is zone 1, evening is zone 2, and giving some normal days in the middle of these abnormal days where the dining room will still be spaced out. We'll be having the tables spread about 10 feet apart. And if you have a spouse that you live with, you'll dine in the same table, but you'll dine 10 feet away from a table with your neighbor. So in that case, we're reintegrating and using the common areas, but you're still within the same cluster of individuals who have the same staff that are providing the same services to the residents, and believe this is already, you're within an exposure point for anyone who provides services to you, and that as we keep that group together, we can begin to start using the dining room and using the libraries and these other areas. So that'll happen as a part of phase 2. We'll be looking at how do we use it, and then what precautions are taken in between use that might require it to be done by a day in between or by time of day to separate for proper infection control between one resident or one zone's use to another zone's use. And we probably will start slow and continue to pick it up because we're going to get better and better about these infection control processes. We even have to think about, you have to walk in and out the same door, and getting comfortable with some of those practices to make sure that we don't create any cross-contamination risks or exposure risks from one zone to the next. And this is all new. All senior communities are learning this at once. And we're sharing a lot of best practices from one company to the next. And to our understanding is the best way to start using the common areas will be to start this slow process of a zone at a time and a day at a time. We also will be looking at more outdoor events, but outdoor events we may do by multiple zones. So we might have you're under the porte-cochere, we might have one zone on one side and another zone on the other, and or using a courtyard area where we could create some safe distancing, but have one entertainer. Isn't that going to be nice when we can get our live entertainers back at the community and we're having a barbecue event? Those are some of the events we envision in phase 2 that, or if it is happy hour with an entertainer and separated by zone, but start to see some of the people that you've developed close relationships with. But we anticipate phase 2 is when we start that process. We also will continue to expand our visiting hours. So we may be looking at that time, if the state allows, we may be able to see face-to-face visits outdoors versus it now being by glass or a second floor balcony separation, or ways that we can do it in a more outdoor, more organized fashion so more families can visit at a single time than how we're limited now by the number of virtual tablets we have available or the number of windows and whether or not you have access to a window. This expands that opportunity for visiting. We'll begin also doing employee interviews on site. It'll be in a separate area, in an administrative area, not into the general public of where residents may be or where they're in the common areas. But at this time, we're having all interviews happen off-site by Zoom. And it's working fine, so there's no reason to introduce that any faster than we have to. But we have to be able to continue to hire people, especially with a lot of people out of work right now. We're just starting to see some benefit where we're having more applicants. People who would never have considered senior housing are now considering senior housing. So we'll look to move that back on site in some limited capacity. So that's phase 2. So new cases are really low. We expect that phase 2 will probably be fairly short because at this rate, with most of these happening in June, we expect by July, probably toward the last half of July, everyone will have hit their phase 3, which is when we believe the visitation will be back in a more normal way, where family members are coming back into the community, maybe wearing some PPE as a result. Live entertainment will occur in a more normalized, in a normal fashion. Our dining room will begin to integrate with limited seating capacity, but across zones. And same thing for our common areas. I can't imagine us having our sofas and our love seats out anytime soon. We'll do a lot of armchair, spacing it out so that we're safely setting up the physical layout of our common areas to promote these best practices. This is probably also when it's a better time for you to begin considering using your vehicle, your private vehicle. At this time, if we can't bring people in, we're also asking that you not leave. That's the same ask, is that it's in and out. The exposure is the same. But I would imagine by phase 3, you may start to use your vehicle for the essential visits that you've got to do and where you need to go. So we'll be monitoring that. We might also find that that's somebody who lives in independent living may be able to do a lot sooner, because the state could control a little longer in assisted living whether or not we have normal resident transportation. So we'll be tracking that, and we may have to modify based on those special circumstances. The other thing is we are not having people come in and physically tour our community that are looking to move into our property or move into any of our communities. At this time, we are visiting with people remotely. We are going to allow walk-ins to come to our screening point and schedule virtual visits. We may see that over the next phase or 2, but we believe by phase 3, just because we now could have visitation, we probably will have tours going on again in folks considering senior housing and making a move. So we expect that to be a little different for the next 2 or 3 months, but probably a little more normal late July, early August, as we are implementing phase 3. And then phase 4 is end of the COVID pandemic. So once we get kind of word, we might see phase 3 last a long time. But man, it's going to be a party when we hear phase 4 steps in. But at that point, I still think that we've learned so much about infection control that we'll still have some element of screening. And we'll still see some kind of changes in the new normal. But we believe that all business will feel more normal. We just may have it's going to be a little harder on us as operators and as supporters of the services we provide to you. We're going to be it's just going to be a different mindset about infection control. We're already seeing that states have sent out surveys to individual communities to understand about infection control practices I would imagine it's going to be something we're going to keep talking about, and we're going to just see the bar raise higher and higher. We already enjoy some fun technology. We have those spray packs that look like your Ghostbusters, spraying throughout the community and treating to encapsulate surfaces. I imagine we're going to see more. We're on, hopefully by mid-June, we'll have more of those packs at each of the communities. I think most of them only have one right now, and a few of them don't have any and have been sharing other communities' packs. But I think that's going to be more normal that we use to treat as flu season comes around, and some of these screening processes and monitoring the temperature may never end. And we're going to look for ways to do it more passively instead of the kind of cumbersome way it's being done right now. But that is by far the best we can do with what technology is readily available. We also may see antibody testing. We just don't know. That may become a part of a normal routine for new move-ins or new employees that are working for the company. And we're going to be closely monitoring that to understand how we can fold that into our new sense of normal. But phase 4 will be kind of a whole new process. But please know, we look at infection control very differently. It is something that we have as in services of our employees. I mean, they go through hours and hours of infection control training. And the one thing I have to say, and you may feel this yourself, you think of how many times you've washed your hands in the last 6 to 8 weeks compared to what you may have done 6 months ago. We're all doing it a lot more. But we also right now are a little battle fatigued. It's been a long time where things have felt very restricted, and it could be one slip where we forget to wash our hands leaving the apartment, or forget to wash our hands coming back in, or we forget to wipe something down that could cause a reemergence of this. So it's important that we keep our vigilant precautions in place, even though the risk is away. As I watch more about pandemics and what's happening with, animals being mixed with other animals, and some of the thoughts as to how this may have started in a lab or the wet market, or we will find out in the months to come. But what they say is that there's multiple SARS-like viruses like this, and this is actually one of the weaker ones. So it is scary to think, what we are exposed to with how interconnected we are as a world, and that these practices will serve us well as we manage through other risks. And unfortunately, still the number one cause of death on a seasonal basis is flu. And I can tell you, we probably entered this flu season with much better practices than any hospital ever has in the past, or any skilled nursing, or even our practices have been at this extreme level. That be our new normal? That we have better flu seasons because we're taking better infection control. So I think there will be positives, but there will be changes that unfortunately will remain normal. So on that note, I wanted, Kayla, for you to speak just a little bit about the House Cup and the virtual events, and then we can open up to any questions.
Yes. Okay, so I'll be pretty short and sweet so we can have time for you guys to give some feedback. So the House Cup competition, that's been going on for a week or two in some of your guys' communities. And that's just a fun competition that's probably happening in each of your zones. It's been a lot of fun to hear some of the feedback that has come from you guys, and then also the staff, and how fun this little competition and just how sometimes it can just bring a little bit of light to everyone's day. So I encourage you guys to keep doing those hallway events and gaining points for your team. I know that there are a couple of people doing Olympics times, and then some are doing Olympic House Cup challenges. And so just participate in what your building is offering, and be the best team win or best zone win. But that's kind of the House Cup competition. And then we are continuing the virtual event. So this is one of the virtual events. So I'm seeing 109 people, and I think I saw it up to 117 a little bit ago. So I know that there's 117 of you guys that can get on the virtual events. So that's exciting to see. And then, yes, Stephanie, let me unmute you. I'm sorry. Sorry, hold on. There you are. Okay, there you go.
Kevin.
Yes. So yeah, we'll continue to do this virtual events. Just, I think you guys receive a weekly virtual event every single, probably Friday or Monday. And so we have a lot of events kind of in place from week to week, but we do have special speakers and special singers. And it's been a lot of fun for me to be able to help host some of those. So if you have interest, talk to your resident services director or your zone leader. And I would love to find something that's pertaining to you guys. Actually, in about 12 minutes, we have Austin Carr, that used to play for the Cleveland Cavaliers, going to be coming on and kind of talking through his history of being a player, and now he's an announcer for the Cleveland Cavaliers. That's almost a tongue twister. I've never thought that I would have that much trouble saying that. But yeah. Anyway, so there's lots of different events that I think you guys could tune into and really enjoy. But yeah, and then also, Stephanie, do you want me to talk a little bit about how to find them on YouTube, or do you have time for that?
We're losing you, Kayla.
Oh. Okay, I'll let you take it away then.
Okay, what I'm thinking is, in the interest of time, knowing that we have a big event coming up here, what I was going to suggest is that if you're okay with this, Kayla, maybe we do this again next Monday. We eventually see us going to every other week and eventually like once a month when we have major updates. And right now I feel like we have a lot of big moving parts, and I want to give those opportunities to explain what we're working on. But my guess is there's going to be a lot more questions about phase 1 and phase 2. And I didn't realize once we hit over 100 people, it's going to be hard if we open up the chat right now, because there's just so many questions that may exist or may pop up. What I'd like to do, and I'm kind of seeing a couple of these folks here like Rachel and Kayla, if we could open up questions in advance to this call next week, I would be willing to do another one again Monday, and we turn in any questions that pop up. But in the meantime, each of the executive directors, we're going to be encouraging them to use this virtual format or go to the zones to do more town halls, because we're all walking into uncharted territory. And the one other thing I wanted to share is that a industry commission has been set up by the Department of Health actually, basically not. It's being set up by the President's Commission on COVID-19. That is a bunch of healthcare professionals and long-term care providers, which we fall as an umbrella under that group. And they started open conversations about how to reopen our communities or reintegrate our communities. We've submitted our plan as an example plan, and we're looking to see these groups vetting it out and giving us more feedback. So we know there are going to be modifications. We may have another version of this to share with more detail. So I'd be open for us to use that question format for next week and filter those questions through your zone, because your zone can then get that submitted, or email or come on the Facebook page and post on there as well. So I think that may be a better way given the time constraint. So lots to come, and thank you for your time. And I look forward to us being able to have more robust exchanges in this format. And apologize, we covered a lot. We covered 4 phases. We covered in the beginning of a pandemic on a call. So it's a lot to cover, but I'm hopeful that in the next couple weeks, we can be able to answer more specific questions that you have by your executive director filling in the specific information for your community, or for me being able to give you any other answers as to why or thought processes. We're in this together. And it has been the questions of families and residents that has pushed us in a lot of ways to make decisions in areas that we never thought we'd be making decisions on, but they were important. And then when we got asked, it was like, that is very important. So we do learn from each other in this process. So on that note, I want to thank you for your time, and I look forward to catching up again on Monday and taking that time to field all the questions that come in between now and Monday. So